Professor Pallas here with the Week 13 wrap-up. Our survey this week focused on risks associated with surgical interventions for weight loss. It's important that you understand the risks that are associated with weight loss surgeries. You will need to educate clients on these risks and make sure that they thoroughly understand the risks before and after surgery so that they can take appropriate steps to minimize their chances for these risks. There's no correct answer to this survey question. It's interesting, however, to see what the class thought. 40% of you were concerned about the risk for vitamin and mineral deficiency after a surgical intervention for weight loss. This is a very valid concern because in most cases, part of the small intestine will be circumvented and the nutrients and vitamins, especially B12, that would be absorbed in those areas are at higher risk for deficiency. People who have surgical interventions for weight loss are required to take vitamins and mineral supplements after the surgery for the rest of their lives. 53% of you were concerned about the risk for weight regain related to difficulties maintaining the lifestyle. This is another valid concern. It's very difficult to maintain a lifestyle where you're limited to eat extremely small portions of food and when you're limited in the amount of fluid that you can drink when you're eating. And while we're talking about fluids, 7% of the class were concerned about the risk for dehydration. This is a real risk because people who have weight loss surgeries where their stomach is significantly reduced in volume are recommended or required not to drink fluids at mealtime. Mealtime is reserved specifically for eating solid food because the volume that the stomach can hold is so much smaller than it was previously, and you do not want to stretch that stomach back out again. It's important to remember that while there are these risks associated with surgery, there's a tremendous amount of success that is associated with surgical interventions for weight loss. About 50% of people who have a surgery for weight loss will maintain a loss of about 50% of the excess weight that they were carrying for as long as 5 years after the surgery. That is definitely a successful statistic. Let's take a moment to review the due dates for this class. We will continue to try to keep the due dates on Sundays at 11:59 p.m., which was a goal we've had from the beginning for this class. We have our final group discussion this week during week 14. Your initial post is due Wednesday night at 11:59 p.m., as it always is, and your 2 peer responses are due Sunday night at 11:59 p.m. It is also important to recognize that you have 2 additional projects that are due to complete this class. The group project, which is your targeted obesity prevention and treatment plan, is due May 5th at 11:59 p.m. And your final reflection paper, which will take you back to your very first class survey and your very first discussion, that final reflection is due during finals week, which is the week of May 6th through 11th. During finals week, you will write and post your final reflection paper. In this paper, you will discuss what you learned in this class and how it pertains specifically to your personal class objective. In the very first survey that we answered, you selected one of 3 objectives to be your personal objective for this class. You then went on in your very first discussion board post to talk a little bit more about that objective and why it mattered to you. In this final reflection paper, you will return to that personal objective and you will talk about what you've learned relating to that objective. In this post, there are a few things that you'll need to include. You'll need to define what an evidence-based practice is and identify what role this plays in our education as nutritional professionals, and also how you will use an evidence-based practice to counsel future clients who are overweight or obese. It will be very important that you refer to your understanding of the energy balance equation in this reflection paper. We've talked about the energy balance equation over and over again. We'll continue to talk about it in these last 2 weeks of class. Make sure that you refer to that in your paper. You also want to discuss health effects of obesity and non-health effects of obesity. And you should identify and discuss at least 2 factors that define an obesogenic attitude or environment and how your perspective on obesity has changed as a result of taking this class. So again, refer back to that very first class survey and your very first discussion board post when you start to write this paper. I will review the final reflection paper again next week during week 15 of the class, but here's a slide if you'd like to pause this video that bullets out in numbers the items that I'll be looking for in that final reflection paper. To wrap up week 13, let's take one more look about the 2 subjects that we focused on this week. We focused on public policy and pediatric obesity. Public policy may inform an obesogenic environment and also obesogenic attitudes. Public policy may not be the answer to curing the problem of obesity, but it certainly could play a role in helping us cure the problem of obesity. If you're interested in getting more involved, there are many opportunities for you to become involved and help inform public policy. Refer back to the class lecture and PowerPoint slides for links and other ways to connect with organizations that are interested in promoting public policy to help better manage an obesogenic environment. During the discussion on pediatric obesity, we learned that this is a growing concern not only in the United States, but also in the world. And there are many comorbidities that children are experiencing as a result of being obese at a young age. It is very important to understand and recognize that interventions for pediatric patients will be very different from interventions that you create for adult patients. It's also important to recognize that one of the primary goals for a pediatric patient is not weight loss. The goal is weight maintenance with the hope that the patient will grow into that weight. Thank you so much for your time.